A severe warning. Bird flu strikes in the United States. In December 2024, the CDC confirmed the first severe human case of bird flu, H5N1, in Louisiana. This alarming development has raised concerns about the potential for wider spread and the implications for public health. The case serves as a stark reminder of the interconnectedness of human and animal health. The situation demands immediate attention and underscores the importance of understanding the virus and its transmission. The virus has been circulating in wild bird populations and poultry flocks for years. However, the confirmation of a severe human case marks a significant escalation of the risk. It signals the virus's ability to jump from birds to humans and potentially cause severe illness. The case in Louisiana has brought the issue to the forefront, raising concerns about the potential for further spread. The interconnectedness of our world, coupled with factors such as climate change and globalization, creates an environment conducive to the emergence and spread of infectious diseases. The bird flu case in Louisiana underscores the vulnerability of even the most developed countries to infectious disease outbreaks. Understanding the virus, its modes of transmission, and the potential risks it poses is crucial for mounting an effective response. As we delve deeper into the specifics of this case, we gain a clearer understanding of the challenges we face and the importance of proactive measures to protect public health.
The first severe human case of bird flu in the US involved a patient over 65 with underlying health conditions. This individual, residing in Louisiana, had direct exposure to infected backyard flocks. The patient's age and pre-existing health issues likely made them more susceptible to severe illness. The patient's condition deteriorated rapidly, leading to hospitalization. This case underscores the vulnerability of individuals with underlying health conditions. It highlights the importance of taking extra precautions for high-risk groups. The CDC emphasizes avoiding contact with birds and practicing hand hygiene. Early detection and treatment are crucial in managing bird flu infections. This case provides valuable insights into the virus's behavior and impact on human health. The patient's exposure underscores the role of poultry in spreading bird flu. It highlights the importance of biosecurity measures to prevent the virus from spreading. The CDC recommends strict biosecurity protocols for those in contact with poultry. The severity of this case serves as a reminder of the potential consequences of bird flu infection. Continued surveillance, rapid diagnosis, and effective treatment are needed to mitigate the impact of this virus. Public awareness and education are crucial to prevent further spread. By understanding the risks and taking precautions, we can better protect vulnerable populations.
To fully grasp the complexities of the bird flu threat, it is crucial to delve into the world of viral genotypes. These genetic variations within the virus dictate its characteristics, including its ability to infect different species and the severity of the illness it causes. Two specific genotypes, D1, 1 and B3.13, have taken center stage in the recent bird flu outbreak. The D1 genotype, linked primarily to wild birds, has been detected in the Louisiana case, as well as in recent human infections in Washington state and Canada. This genotype's ability to circulate widely among wild bird populations raises concerns about its potential to spread across geographical boundaries. Its presence in multiple human cases underscores the potential for spillover from birds to humans. In contrast, the B3.13 genotype has emerged as a significant threat to dairy cattle, causing widespread outbreaks in these economically vital herds. This genotype's affinity for cattle has raised concerns about the potential for economic disruption and increased human exposure. The emergence of these distinct genotypes underscores the constantly evolving nature of the bird flu virus. The co-circulation of multiple genotypes necessitates a multifaceted approach to surveillance, prevention, and control.
Section 4, From Birds to Bovines, bird flu spreads to dairy cattle. The bird flu outbreak has extended its reach beyond wild birds and backyard flocks, infiltrating dairy cattle populations with alarming speed. California, a leading dairy producer, has been particularly hard hit, with over 300 dairy herds reporting infections in a mere 30 days. This rapid spread among dairy cattle has triggered a state of emergency, prompting a swift and coordinated response. The spread of bird flu to dairy cattle poses a multi-pronged threat. Economically, it threatens to disrupt milk production and distribution networks, potentially leading to shortages and price hikes. The culling of infected herds to prevent further spread can have devastating financial consequences for dairy farmers. Beyond the economic ramifications, the spread of bird flu among dairy cattle raises concerns about increased human exposure. Dairy workers, veterinarians, and others who come into close contact with infected animals are at a heightened risk of infection. Enhanced surveillance measures, including regular testing of cattle and strict biosecurity protocols on dairy farms, are crucial to contain the spread. The situation highlights the interconnectedness of animal and human health and the need for a One Health approach.
Section 5. Recognizing the enemy, symptoms of bird flu. Understanding the symptoms of bird flu is paramount in facilitating early detection, prompt treatment, and effective containment. The virus can manifest in a range of symptoms, from mild discomfort to severe, life-threatening illness. In its milder forms, bird flu can mimic the common cold or flu, with symptoms such as sore throat, cough, fever, and muscle aches. However, bird flu can progress rapidly to a more severe form, characterized by shortness of breath, difficulty breathing, and chest pain. Other severe symptoms include nausea, vomiting, diarrhea, seizures, and altered mental status. Early recognition of bird flu symptoms is crucial for prompt medical intervention and improved outcomes.
Section 6. Public Health at Risk, Assessing the Threat. The confirmation of a severe human case of bird flu in the US has understandably raised concerns about the potential for a wider outbreak. While the situation warrants careful monitoring, it is important to approach the issue with a balanced perspective. The primary concern surrounding bird flu is its potential to mutate into a form that can easily spread between humans. Currently, human-to-human transmission of bird flu is rare and typically occurs only through close contact with infected individuals. Despite these concerns, several factors suggest that the risk to the general public remains low. The majority of human cases have been linked to direct contact with infected birds, and there have been no documented cases of sustained community spread. While the risk to the general public is currently considered low, certain groups face a heightened risk of infection.
Section 7. Staying safe. Prevention and protection. While the emergence of bird flu in the US is concerning, there are several proactive steps individuals can take to protect themselves. By following these recommendations, we can minimize the risk of transmission. The most effective way to prevent bird flu infection is to avoid contact with infected birds and their droppings. If contact with birds is unavoidable, it is crucial to wear appropriate personal protective equipment and to wash hands thoroughly afterward. Proper food safety practices are also essential in preventing bird flu infection. Poultry and eggs should be cooked thoroughly to an internal temperature of 165 degrees Fahrenheit. Maintaining good personal hygiene is crucial in preventing the spread of bird flu. This includes washing hands frequently with soap and water and covering coughs and sneezes with a tissue or elbow. By remaining informed and practicing good hygiene, we can collectively contribute to the effort to contain the bird flu outbreak and protect public health.